a world where stress is constant and burnout feels inevitable, more people are turning to adaptogen herbs to help the body bounce back. Let's welcome back Dr. J.P. Saleeby, Medical Director for Carolina Holistic Medicine, to further dive into these natural compounds that are being used to achieve personalized wellness. So let's start here. What is an adaptogen herb?
Well, it's a special herb that has to meet certain criteria to be called that. Now, I wrote a book back in 2006. Back then, there were about 24, 25 known adaptogens. Now, there's about 75.
Oh, wow.
So they keep adding them once these herbs, these botanicals meet certain criteria.
Okay.
So they're all natural, they can't be toxic, and they have to have sometimes bidirectional effects, like it can raise and or lower blood pressure or glucose levels.
So how do you apply that? If you have high blood pressure, how do you make sure it doesn't go higher?
Right. So we typically, if somebody has hypertension, high blood pressure, and they take a particular herb, it'll lower it to what we consider normal levels. Same thing, the same herb, the same dose can actually raise blood pressure if somebody's blood pressure is too low.
That's incredible. That's amazing. Nature is unbelievable,
Yes.
isn't it, truly?
Yeah.
So when you use these adaptogen herbs, there's also a choreography of mixing things together in order to exalt their powers.
Right.
So how do you figure that out?
Well, that's a cultural thing. So if you look at traditional Chinese medicine, in Asia, they usually don't use single agents. They usually use what they call patents, which is a combination of multiple herbs, 3, 5, 6 different adaptogens. And they don't all have to be adaptogens. Like they may mix ashwagandha with tulsi, which is holy basil, with eleuthero.
What would that effect give you?
Well, I mean, it depends what you're treating.
Oh, okay.
So in Chinese medicine, herbology, they don't prescribe drugs. They look at herbs and botanicals. So they're very adept at selecting certain patents, and some have been around for hundreds, if not thousands of years.
Sure, yeah.
And so, you know, the test of time. In the West, we typically like to write for one particular herb at a time, like ashwagandha at nighttime for better sleep.
It's known as nature's Xanax.
Yes, right.
Yeah.
And some of them, like maca root, might help with erectile dysfunction and lack of libido. And some of them may increase testosterone levels in men. So in the West, we usually use 1 or 2, you know, but the sky's the limit. You can stack them, you can rotate them, you can pulse them. Like take this for a while, then switch to that. So there's all kinds of combinations.
What about Moringa?
So Moringa is interesting. That's a newer adaptogen that's been identified. It is a fascinating botanical in that it has all 9 essential amino acids in it. It is used to help with the thyroid in particular. It's used to help with bowel movements, people that are constipated. It helps modulate the thyroid and it helps with sleep.
Sounds like it might be nature's Wegovy.
It could be, yes, and there is some associated weight loss with it too.
There is, okay. So when you say thyroid, does it also affect diabetes? So let's say you didn't want to use it for weight loss, but would it have the same effect as those brand names?
Yeah,
you know?
so adaptogens help the body address stress.
Okay.
So usually the reason people cannot lose weight is because they're full of inflammation, whether it's related to their gut, their microbiome, or other conditions. And very often, not always, but adaptogenic herbs can help with that.
Oh, interesting. And you kind of already answered my question. Is this a new thing? Is this an ancient thing? Well, clearly it is quite ancient, and people have been using it for eons.
Yes. Yeah, the Chinese have been using it for 2,000 to 3,000 years. Ayurvedic, which is an Indian medicine, even longer than that. The naturopaths have been doing it for hundreds of years.
What is the role of peptides in all of this?
Okay, so peptides are, when I talk about there are natural peptides, healing peptides. Probably one of the first discovered was insulin. So insulin, growth hormone, those are all peptides. But when we talk about peptide therapy for humans, for wellness, for muscle and bone and tendon recovery, there's one called BPC 157, researched in the former Soviet Union 40 years ago. We now know about it, and it's very helpful in taking care of certain conditions.
Interesting. So when we are thinking about adaptogen, we're thinking about sort of a whole wellness of body, mind, musculoskeletal. So really this is something that you can invest in in the long term, that this is for everyone, because at some point or another, we're all going to have stress.
Right.
So you could almost preempt it
Yeah.
by taking some of these herbs.
Exactly. The botanicals are easier to get a hold of.
Okay.
They're readily available. Some people need guidance as to which ones to use and how long to stay on them. Peptides is a little trickier. There are hundreds of different peptides. Many of them have to be injected, like insulin.
Oh.
There are a few that are gut stable. You can take them orally. Sublingual, there are mouth sprays. So again, you need some guidance. That's a little trickier on those. But you can combine botanical adaptogens with healing peptides.
Could someone come and see you and just sort of get like a once-over and an assessment as to what they could use at this stage of their life?
So if they're well and they want to maintain wellness and longevity is their goal, that's for sure. A lot of times our patients have certain issues they want to get another angle at.
Yeah.
So yeah, we do both.
Okay, very good. Well, thank you so much. This is really interesting. I'd like to come in and get an assessment.
Absolutely.
All right, Dr. Saleeby, thank you. We'll be back after this.